My name is Dr. Manish Varma. I am a liver transplant surgeon and I work at Apollo Hospital, Jubilee Hills, and I am the chief surgeon here. We do transplantations of the liver for adults, for pediatric patients, for kids. We also do transplantations of the pancreas. We do kidney transplant. So it is a multi-organ transplant. So today we have we met here to talk about 2 or 3 important things. The first is that there are still, although liver transplant is being done is done commonly now, but there are still some misconceptions about the liver transplant, and the biggest misconception now is that the results are not good. And we hear that very commonly whenever we talk to our patients, and the biggest hesitation for any patient to undergo a liver transplant is whether it is going to be successful. So we have been running this program for almost 1.5 years now with good volumes, and good volumes are good number of operations, and now we have our results, so we can say with full confidence that our results here, the success rates are more than 97%. So 97.4% success rates, which is like a benchmark. Right? So that was the one most important thing that we had to come across. Right? We wanted to come with that liver transplant is a safe operation now. It is a big operation, yes. It is a complex operation, yes. Requires a big team, good infrastructure, yes. But it is an unsafe operation, no. Right? So less than 3%, like 2.5% failure rates is like any other major operation. So that is one. The other thing was that today we had called one of our patients, a 4.5-year-old baby, who got a transplant done less than 3 weeks, 19 days ago. So now she is discharged. Liver transplant, yes. So she got a liver transplant done, and this was done through a cadaver donation. Right? Somebody had donated an organ after the person had died. So that was one important message, right? That organ donation, whenever it is done, then it has a very important role to play in the well-being of people, the needy people who need organs. They all have to. So that was one message. Tomorrow is World Organ Donation Day. So on the eve of that, we have had this press conference wherein we talk about the importance of the organs, right? How it helps other people, and the biggest example is this 4.5-year-old girl, right, who successfully underwent this transplant. The third thing is about pediatric transplants. Like among all the centers who do liver transplants all across the world, probably 10 to 15% only would be doing pediatric transplants, because it's a complex exercise. Many team members are required. Huge team is required. We had our all the team today here, so almost 15-20 people, and that is not the entire team. There are only those people who could come here. Okay. Right? There are a lot more who had worked for this transplant. So big team required. But all these things done now. Transplantation as a science has come to such an extent wherein we can do even complex things, meticulous, fine things very, very successfully. So that was one thing. The other thing is that, so these 3, plus the 4th thing that we wanted to say, that the general perception is that if people do not have donors in their family to donate organs, whether it is kidney or liver, then there is no hope for them. Right? So that is not true. The government has come up with a very good program. There is a government body called Jeevan Daan, and they are spearheading this organ donation drive. Apollo Hospital is a partner with them, and we are also doing our bit. We in fact have the maximum number of organ donations done in the state through our hospital. So people, like in our practice, around 70% of all our patients who get a liver transplant, they get it done through cadavers. We do live donors, we do them successfully. In fact, our cadaver transplant results are 97.4. Live donors, we have about 100% success rates. Nobody has had a bad outcome as far as live donor is concerned. But then, when somebody has got a liver disease or an end organ failure, it is not a hopeless situation for them if they don't have donors. Right? So it is a very balanced program, and if we run it right, then majority of the people who come, right, with a balanced approach in which we offer them organ transplants through cadavers, through live donors, we will be able to help the majority of them. So these are the 4 important things that we were talking about all this. So in the last 1.5 years, we have been doing it in good numbers. So every month we will on an average do 4 to 6 transplants. So Jeevan Daan is not specifically associated with Apollo. Right? Jeevan Daan is the government body which is responsible for taking this organ donation movement, responsible for allocating the organs. So it's not like I have an organ I give to anybody whom I want. All the allocations have to go through Jivan Dan. They are responsible for maintaining the waiting list of all the people who need the transplant. So, and all the hospitals, Apollo being one of them, right? All the hospitals we partner with Jivan Dan. It's not a one-to-one relationship. Okay. Jivan Dan is the government body, and we all, when we say we all, not just Apollo, but all the hospitals we partner. Now, because of the commitment from the hospital management, commitment of Apollo hospitals to organ transplant per se, because for the last 15 years, you talk about the benchmark in transplantation, it has been Apollo hospitals, first liver transplant, first pediatric transplant, everything has, so Apollo hospital has taken organ transplant in a very, very committed manner. So because of that, majority of the organs that have been donated, they have been donated in Apollo hospital, but everything is through Jivan Dan. So that is one. So after the Jivan Dan has come into play, there are two important things that have happened. One, that the process of organ donation has become a little streamlined. So whenever there is an organ available, more chances that it will get procured in a usable situation. That is one. And the second is that the allocation of organs to the needy people is directly done by the government. Okay. Right. No malpractices. So no malpractices. Right. So the practice of organ transplantation has become transparent. It has become fair, right, and it has become more justified, so that everyone has an equal opportunity of getting cured. So these are two contributions. Big, I would think. There are many more, but these are the two important that come. So two important message. One is that for the patients, liver transplant is a successful operation. You don't have to worry about the success rates. The chances of a transplant being successful or failure are similar to any other major operation, right? So that is one. So less than 2.5% failure rates is an achievement in itself, and we have reached there. We have reached there in our country, in our setup. We keep on talking about the West being better than us, but if you look at the results, 97.5 is probably in the top 5 in the whole world, right? So that is one important message. It is a safe operation in our country also, right? We do it at a fraction of the cost that the same standards will need in the West. So we are doing it probably at 20%, 1/5 of the cost of the same standard of care, right? So that is one thing. So there's important message for the patients. So there is hope, even if you don't have donors. There is a process of getting registered for a cadaver organ. Good chances of getting it done through a cadaver organ, right? Provided you do the right things, take the medicines on time, and remain stable, right? So these are two important messages for the patients. For the community per se, the most important message is that don't waste your organs. We understand, all of us have gone through it, all of us have lost our nears and dears, right, at some point in time. It is an ongoing cycle. We will keep on losing more, right? But now, at least, if we have not thought about it in the past, at least from today on, we have to start thinking that people can live even after they are dead. And they can live not in one person, but in 8 different people in the form of living organs, right? So the message is, if I put it dramatically, that death is not a terminal event. It is an opportunity to multiply your life 8 times, right? So this is the message that has to go to the community.